tripod or whatever, car pod, whatever you're gonna call it. I had one I've been using. Then there was another one that was right here, and I think I have one here that seems to be working okay. I've never had it at this angle before. I used to have one that was right here on the dash, but because of the heat and cold or whatever, it would just melt off. So you can't really see my evil eye protecting me as I drive or whatever. But it's there. It is there. All right. So I call this one "We Leveled Up." Only because we're not done. we got a lot done today, and it's funny that the doctor, she was like, I just don't understand anything that what you're explaining to me, which again, I totally get it because I'm the one with my brother this whole entire time, um going through all the stuff. And I know it's hard for people to, like, I promise you, one of the reasons why I started this blogging is so I could keep up. Because otherwise, some days were like, 2 days felt like 2 weeks, right? And that we haven't had those kind of days in a while. So today, again, feels like we've had a day. I won't say 2 weeks. I mean, I haven't seen him this afternoon, so I'm about to go in there now. But this morning was pretty chill for him. Um, I made sure he had some calming tea this morning, along with I switched the amino acids that I put in his protein shake last night, so that helped him sleep better. So he seemed pretty chill, even though he did have some reactions in the office, and I mentioned that earlier. And he did try to start some mess as far as like not trying to answer questions or go back on what he was saying that he was going to do. Meaning, me and my friend asked him, "Are you willing to get blood drawn today?" And he was like, "Yes." In fact, he was under the impression that she just showed up, so he forgot that he had a doctor's appointment. So this morning, when I kind of was just like, "Oh, so and so's here. She just wants to visit, and you know what? Since she's here, how about we just go to the clinic?" And he was like, "Okay." Um, and as I was saying that, he was like, "Well, can I get my blood drawn?" So he wanted that, you know, and yeah. So like I said, talking to the doctor, it was helpful to have my friend there. Um, and it's funny that she even said, she was like, "Yeah, it seemed like the doctor didn't want to believe you until I started telling her that I'm a nurse too." I was like, yeah, that's what I'm getting. It's like people don't believe all the stuff that I've gone through and to get this far without being a social worker, right? I'm a finder of things and I'm a way getter, okay? So, I mean, think about this, y'all. So, I mean, there are people who are lambs and there are people who are black sheep. I'm not saying I'm a black sheep of my family, but I'm saying I'm more goat energy, as in not the goat, but I'm more like I'm gonna just do what I want. I'm gonna do what I need to do. That kind of energy. So I'm not like doop, 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 doop. Now rams on the, see, I'm going getting off the topic here, but basically I'm just saying it's like there's a way to get things. Okay. Of course, there are rules and laws, and some people just take whatever somebody says at a front desk at word. I'm not saying I'm acting like a Karen or anything like that, but I'm just asking the right questions or trying to. So part of it is that it's like you got to know what to ask for or what can you ask for, So let me remind you, and what I was telling my friend while we were waiting for the doctor, like she went in and out a couple of times, that I went back to one of the clinics earlier this year because they stopped taking phone calls directly. So it went back to the major hospital that it was attached to. So here in the city in Atlanta, we've got at least, like, if I sat down, like, we've got three major hospitals. I think we have four actually. So I'm just throwing up the three just because. But let's just say it's three. Actually, it is four. So it's four major hospitals. And so one of them is attached to the clinic that I was trying to originally get my brother to. They used to have a phone number to that clinic. They stopped and turned that number into the main, like, number to the hospital. And I was like, we're right there. We're half a mile away from the clinic. Why am I calling the hospital, which is 3 miles away, right? When I can just walk over there. And that's what I did one day. I went over. Oh, thank you. My I'm pretty carefree. But anyway, so yeah, I go over there to the clinic, and luckily the woman, she had seen me before, me and my brother, and she was just like, "Hey, how's it going?" and that kind of thing. And I start asking her, I was like, "Hey, I tried to call here for an appointment." She was like, "Yeah, yeah, they kind of rerouted all the clinics back to the hospital, and it's on this one big robocall system now." And I'm like, "Oh, yeah." Mhm. So it's been really difficult. That was that. And then I even told my friend the other day, um, that I tried to, and I mentioned my chart a few times on a few videos in the last couple of days. That is kind of like your medical account, when you go see your doctor, if you have a doctor. And so on my brother's medical account, there is a feature where you can email the doctor. And at one time, seriously, last week when I went to look on there, the email feature was missing. It was gone. So I've had access to his medical account. He gave me access to it, like, over the summer. And so I have we can email the doctor if you like, right? But you can't email the doctor if you don't have the access, right? You know what I mean? So things like that make it really hard to try to get care for somebody who really needs the care, to stay out of harm's way, to stay out, like, stay, safe medically, you know? And it is really frustrating, I will say. Um, and I've called people, like, I mean, I don't know where that notebook is. There was one time where I thought of maybe my brother does need to be in a group home, but even that, like, he's not sick enough, according to, like, the state of how bad things are out here. Like, he's not sick enough to be in a group home. So even if I wanted to send him to a group home at this point, like, I can't because he's not sick enough. And then there's the other care, for which I didn't even think about that part. So apparently the state of Georgia can provide people who are disabled with certain other amenities. Now, things like, of course, like, reduced utilities, um, uh, transportation to a doctor, but I'm his transportation because he doesn't want to. Like, you've seen those videos last month, so he tried to not go. Um, so I'm basically his voice at this point, and even sitting in that office today, I mean, he made it very clear, like, he wants me to speak for him when he can't or feels overwhelmed, and I'm okay with doing that. It's just that the legal aspect of it is the difficult part, right? So I looked into guardianship at one time, and again, it's all in the playlist, So, oh yeah, so make sure you like and subscribe. Watch the playlist, seriously. It's like 100 videos, seriously. And it started in last January when my brother ran out, and I am not exaggerating when I say this. He ran out of the doctor's office in the middle of downtown Atlanta, and he did not know where he was. Okay, so that's the very first video. And I had a feeling, like, because we've been through so much, and I, of course, did not get a chance to video what happened before he got to Atlanta. Because that was some stuff too. And maybe I'll sit down with a bev with you, sparkling beverage one night, whatever. Might do a Q&A. I don't know. If you're interested in a Q&A of what had happened, with my brother's journey, not to give out his business, but at the same time, he doesn't mind. Um, I feel like more people should talk about, you know, mental illness, disability, all of these things. There's so many people who know somebody and nobody's talking. It's like an invisible ghostly population of people that I don't see them. I tried at one time. I was trying to take my brother out into the public and stuff, and yeah, there was a lot of not so good situations that happened. And so now I don't really take him anywhere, even though I would love to take him places. But if he can't handle it, he can't handle it, you know. And I just know that this was some good steps. Unfortunately, one of the leads or referrals that the doctor sent me, they already responded saying we don't take his health insurance. I kind of already knew that. And that was the other issue. My brother's on Medicaid, and a lot of these psychiatrists are not taking it. And that leads me to the other point about parity. There are laws in the state of Georgia that kind of penalizes healthcare professionals who discriminate against people seeking mental health care versus physical care. So parity means basically you need to give somebody who is having mental health situations the same energy of care, right? As you would, and I'm hearing a siren right now, as you would if somebody was physically um, having a situation, right? So why is somebody's mental health episode different than somebody having a stroke? It's not, in my opinion. It could potentially both be life threatening. And yeah, like I said, Georgia has these laws, but it's hard to enforce them if people are strategically finding ways not to follow them by like saying, oh, well, we have enough of these patients already, or it'll say on a website that they take the insurance. I've been through at least three different offices this year, either emailing or calling and saying, hey, do you take this? I'm trying to set appointments for my brother. And then their response is, oh, yeah, we don't take that insurance. I said, but it's on your website. You're in a directory like that says that you take this, so that's yet the other thing. So that's one of the things that the doctor, that she gave me three different options. So of course I'm going to fall back on the telemedicine, which that seems to be the only thing working for us right now. But the telemedicine folks, sometimes they don't want to talk to me, because again, HIPAA. And HIPAA is those privacy laws, to respect the patient's privacy, which again, not a problem because my brother has no problem with me doing this. In fact, that's how I know he's doing okay, when he wants me to do this. When he doesn't want me to do it, that's when I know something's wrong, because he thinks he's a doctor. Okay? And yeah. So yeah, but I mean, what else are you gonna do? So when my mom, she sent me a text the other day. She's like, "Thanks so much." She's working on her gratitude love language as well. She's not a big emoter, you know. And so um I mean, I'm just saying, like, what else am I gonna do? If it's your family, what are you gonna, like, what would you do? Just let them do nothing? Like, do nothing? And like I said, I'm a way getter. As a musician, as a black woman in the United States, I've learned how to get things. You got to get it done, honey. You got to get it done. Like, seriously, because otherwise you won't have anything. Okay? Nobody's handing you anything. You got to go for it. You got to get it, because otherwise you're just going to perish. And so I bring that energy full force. And sorry, so that's my alarm to go upstairs. And that's the energy I bring to this. It's like, yeah, I don't expect people to hand it to me. I don't expect it to show up on a silver platter, all the answers. And yeah, it's highly frustrating. Usually, I had a long day, and but I know he's my brother, and he is he really is a good person. That's the thing. It's like, why suffer when you don't have to? And I just kind of think that luckily, I don't have a partner or children to hinder the help that he needs. And I know that sounds harsh, but there's 8 billion people on the planet. I mean, there's people out there. But like I said, he is a kind person. He's smart, he's kind. He doesn't deserve to suffer if he doesn't have to. So yeah, so I got him I got him tacos. Let me see if he ate them. I'm sure he did. And I'm gonna go make his protein shake. And that's what I give him every night. All right, with that, I'm gonna say take care. Bye, y'all. I guess the next level in all of this is trying to find a psychiatrist. Like seriously, is it going to be telemedicine permanently? I don't mind if it is, but the thing is, will they talk to me? These are the cliffhangers that I'm leaving y'all with. It's like, I don't mind, and I don't think my brother minds with sticking with telemedicine for a psychiatrist, but will they talk to us? Because most of it is just medication right now. I don't think he wants to talk to anybody with talk therapy. If he does, I will definitely set that up for him. But right now, we need to make sure we get the medicine. While I also work on building up his health, which I will also say, I know his blood work is going to be amazing because I've been feeding him and keeping junk food out of his life, or as much as possible, because sometimes like I said, he's clever. Where there's a will, there's a way. Okay. All right. Take care, friends. Bye. I guess this does work.